Good morning, everybody. On behalf of Chancellor Michael Collins, I just wanted to welcome everybody to UMass Medical School today. Our institution is incredibly proud of all the people among our faculty and our campus and our physicians who are working to help stem the Ebola outbreak in Liberia. In fact, just this weekend, as part of a grant that we've received, we shipped nearly $1.8 million of personal protective equipment to Liberia. And we're very proud of that. Doctors Trish McQuilkin and Jeff Bailey are here to answer any questions that you may have after the fact about that work. But now, let me introduce Dr. Rick Sacra and his wife Debbie, who are here to make some remarks and then answer any questions you might have.
Good morning. It's great to be here with all of you. I'm so happy as my trip to Liberia is coming up, firming up, getting more real to me. I will be serving at SIM Missionary Hospital called ELWA, just outside Monrovia, Liberia's capital. I'll be there for about 3.5 weeks. I received my visa last week. I got my yellow fever shot on Friday. I took my malaria pill this morning. The UPS and FedEx trucks are frequent visitors at our house. Packages are piling up. Boxes of medicines, supplies, gowns, gloves, lab equipment, destined for Liberia. I'll spend most of my next few days packing excess baggage. Since my discharge from the Nebraska Medical Center at the end of September, where I was treated for Ebola, I've had a few bumps in the road, but God has provided through it all. I was readmitted to the hospital here in October with a cough and a low-grade fever, and I was retested for Ebola at that time, and that was negative. I've had some difficulty with the vision in my left eye, which has required treatment as well. That's mostly cleared up. I had physical therapy to help me regain my strength. You know, I think about those in Liberia who've survived Ebola and are having to deal with all these same kinds of challenges with so much less help than what I've had. My doctor has now cleared me for a full return to work and has said I'm well enough to return to Liberia. In fact, the experts tell me I'm immune. I don't plan to test that, but I'm grateful for it. What will I meet when I'm on the ground back in Monrovia in Liberia? Right now, Liberia is actually in the best shape of the 3 countries hardest hit by the Ebola epidemic. Over the 3 weeks ending January 5th, Liberia had 70 cases of Ebola. By contrast, Guinea had 344 cases confirmed, and Sierra Leone had 900 during that same period of time. There are now sufficient beds available in Ebola treatment units in each country to handle these patients. The average case fatality rate in all 3 countries is about 60%, meaning that 4 out of every 10 Ebola patients become survivors. Healthcare workers have been hard hit. In Liberia, there have been 370 cases of Ebola among healthcare workers and 178 deaths. Treatment trials are beginning now in all 3 countries at the ELWA-2 facility, which is run by ELWA in coordination with Liberia's Ministry of Health. A trial of convalescent plasma is ongoing.
Can anybody hear the press conference? No. Okay.
They say they can't hear. Yeah.
It's occurring. It started a while ago. The phone line stopped.
You know what? I'm just going to turn. Excuse me, technical difficulty.
A trial of convalescent plasma is ongoing at the ELWA facility, in which Ebola patients are given plasma donated by survivors, and we're going to see whether there's a benefit from that.
I just saw the press conference begin on TV, and I sent a quick note off to the hospital.
They can watch it on the live stream. All right. Sorry.
At the ELWA 3 treatment unit, which is run by Doctors Without Borders, a trial of the antiviral drug brincidofovir has also begun. Trials of other drugs and vaccines will soon be underway at other facilities and in all 3 countries. These drugs and vaccines all hold such promise for making Ebola a thing of the past. We may be tempted to become complacent as the number of cases starts to decline in the coming months. But we must not rest until there are 0 cases of Ebola, and we must not rest until the health system in Liberia and in West Africa is strong enough to contain the next outbreak, whether it be of Ebola or some other threat. Health facilities and hospitals in Liberia are still only partially open and partially functioning. In this context where the health system has been crippled, I'm so thankful that God has allowed ELWA to remain open since August 6th, providing care to the people of Monrovia. I feel privileged that I'll be able to join a team of real servants in the next few days, men and women who are taking a significant risk to care for patients with the love and compassion of Jesus every single day. Please keep us in your prayers, that our staff will remain safe, and that the people of Liberia will continue to show the resilience that has brought them through the worst of the storm. Thank you.